एडमिंटन च अलबर्टा के सेहत मंत्री जेसिन कॉम्पिंग और अलबर्टा के सेहत के मुख मैडिकल अफसर डॉक्टर डीना हिंसा वालों चल रही कोविड महामारी ਲਈ प्रांत के जवाब बारे एक अपडेट प्रदान की गई। डॉक्टर डीना हिंसा ने घोषणा की कि प्रांत में 19 अप्रैल तो 25 अप्रैल के विचकार कोविड नाल प्रतिदिन औसतन 9 मौतां होईयां। हिंसा ने दस्सिया कि मरण वालियां दी उम्र 32 ਜਾਂ इस तो वध दी सी। नाल ही उन्हां वल्लों लोकां नूं मास्क दी वरतों करन दी अपील भी की गई।
For today's COVID update, between Tuesday, April 19th to Monday, April 25th, our PCR test positivity ranged from 23.4 to 30.6%, with an average of 25.7% for the week. This is stable from the previous week. As the Minister mentioned, hospitalizations have increased slightly. Currently, there are 1,220 people with COVID-19 in hospital, including 47 in the ICU. Sadly, between April 19th and April 25th, an average of 9 deaths per day related to COVID-19 were reported to Alberta Health. By comparison, US data estimates that prior to COVID, there was an average of 1 death per day per 2 million people for influenza and RSV combined, which would work out to about 2 to 3 deaths per day in Alberta on average. Clearly, COVID is still something we need to be very mindful of. The individuals whose deaths were reported in the last week were between the ages of 32 and 103. Before I speak about COVID today, I want to address some questions we've been getting about cases of severe hepatitis or liver inflammation in children that have been reported in several countries around the world. What we know right now is that roughly 170 cases of sudden liver inflammation in children aged 16 and under have been reported globally, mostly in European countries and the United States. While this is a small number, unfortunately, about 17 of these cases have gone on to need a liver transplant, and sadly, one has died. There are many causes for hepatitis, but in these cases, the most common causes have been ruled out, and it is not clear what led to the condition. There have been no confirmed cases in Alberta to date, and we are working to provide information to frontline physicians on this topic. There is a great deal of work being done on this globally, and some cases have had an adenovirus, which is a common cold virus, identified. It is not clear if this virus is causing the hepatitis, but it is one possible cause that is being explored. For parents in Alberta who may be worried about this, I want to underline the point that this is a very rare condition, with only about 170 cases identified worldwide. If there is an infectious cause of this syndrome, the same things we have been doing as parents over the last 2 years will still be valuable now, such as reminding our kids to clean their hands regularly and continuing to support the important practice of encouraging everyone in our circles to stay home when feeling sick. Using masks in public places is an option for families who wish to add an extra layer of protection. We're working closely with federal, provincial, and territorial partners to monitor emerging information, and we'll keep Albertans informed of any developments.